The thing about myths is they're often based on half-truths, and as the story is passed on from one person to the next, the details change slightly. Once we've heard it often enough, we start to believe it as fact. There are a lot of squat myths and misconceptions, but today we'll look at 3, including whether or not squats cause hemorrhoids. The first myth: squats are the only exercise you need for your lower body, and they're often called a whole body exercise. They do work more than just your quads. One study that compared leg muscle growth after 10 weeks of squats between parallel squats and full depth squats found that the knee extensor or quads, adductors, and gluteus maximus muscles grew in both groups, but the hamstrings and rectus femoris, which is one of the quad muscles, didn't grow at all, illustrating the need for more exercises to achieve complete leg development. We can't forget about our calves either. They're a leg muscle that again isn't sufficiently worked with squats alone. Adding Romanian deadlifts, hamstring curls, leg extensions, and calf raises goes a long way in rounding out our leg training. What about squats being bad for our knees? This comes down to squat form and any pre-existing injuries to your knees. The main form issues are not squatting with your hips back far enough and your knees going too far forward, having your weight shift from mid-foot to the balls of your feet, raising your heels off the ground. This less stable position increases your risk of injury, particularly to your ACL or MCL ligaments. This happens when your knees cave inwards. Other causes of this are weak abductors, which are the gluteus minimus and medius muscles. Most of the time we can resist the tendency of our knees to cave in by conscientiously focusing on pulling our knees outward as we raise out of a squat. Because we're talking about knee pain, we think of the knee joint, but a squat involves 3 joints, our hips, knees, and ankles, and we need to think about all 3 when we squat. This is especially true when you look at whether your knees should go past your toes or not. This can happen naturally based on body mechanics or squat depth. Often when we have a limited range of motion in our ankles, we elevate our heels to compensate, resulting in our knees going past our toes. Trying to keep our knees from going over our toes will affect other joints, and in particular, our hips, with one study finding restricting the forward movement of the knees on the barbell squat inappropriately transfers the force to the hips and low back. Concluding appropriate joint loading during this exercise may require the knees to move slightly past the toes. If you find knee discomfort when yours move past your toes, you can reduce the range of motion or switch to a more knee-friendly squat, like a goblet squat. In another video, I reviewed a study that showed how low-weight, high-repetition squats reduced knee pain from those suffering from osteoarthritis, which is contrary to the theory that they cause pain. I recently discovered that squats can cause hemorrhoids or piles. About 75% of people experience hemorrhoids from time to time. I'm part of that smaller 25%, which may be why I haven't seen this information before, but it's a real issue for a lot of people. And what it comes down to is breathing and bracing technique during the squat. The way you breathe and brace for a high rep squat is different than when doing heavy low repetitions. When we do a higher rep squat, we brace our core. This includes tightening the pelvic floor and glutes. Then we inhale as we descend. Once we reach the bottom, we might hold our breath briefly as we reverse direction and move up out of the most challenging part of the squat. Then we exhale, releasing the internal pressure. With a heavy squat, we do what's called a Valsalva maneuver, where you take a deep belly breath first, then brace your core. The cue of bracing for a punch is often used to illustrate how it should feel. This creates intra-abdominal pressure, allowing for superior stabilization of the spine, which can cause hemorrhoids, especially when we push out of the bottom position. That's why we need to brace against it by tightening our pelvic floor and glutes along with the rest of our core muscles. You inhale, hold your breath, brace your core and pelvic floor throughout the movement, exhaling as you reach the top, then inhale again and brace before your next rep. Not everyone is going to want to do heavy squats. So what about lunges? Do they develop our legs as effectively as squats? Watch this video next to find out, and keep working out while having fun. This is Lawrence from Fit and 50. We'll talk to you again in the next one.